The patient currently has a complete upper denture and a complete lower denture, which is sitting on top of healing abutments. We are in the middle of fabricating a BruxZir full arch prosthesis for the lower arch. The first thing I'm going to do at today's appointment is to remove the healing abutments so we can then try in our wax setup. As we insert our full arch wax setup, it seems the bite registration might have been slightly off. You can see the teeth do not come together the way we would like them to, and as a result, the vertical dimension seems a little excessive. Have no fear, this happens to the best of us. When this happens, I'm going to simply use the setup to take a new bite registration. But before doing so, I need to get back to the proper vertical dimension and CR relationship. Leaving the setup in place, I am going to simply remove the posterior teeth that are causing an interference. Here you can see that I pop the teeth off one at a time, assessing the bite and vertical dimension as I go. In this instance, I wind up popping off all the posterior teeth and slightly moving the anterior teeth into a better position in relation to CR. Remember, the teeth are in wax at this point, so feel free to move the remaining teeth around on your own to ensure the bite and the vertical dimension is correct. Once the remaining teeth are no longer causing an interference and are in the correct position, I'm going to recheck my vertical dimension. Here you can see I'm using a VDO gauge, which helps evaluate the patient's facial thirds based on aesthetics. Since he has a comfortable and aesthetic current denture setup, I am making sure that this vertical dimension of the wax setup is similar to that of the vertical dimension with the removal of prostheses in place. Once the vertical dimension is confirmed, I'm going to have the patient close gently into a CR position. A leaf gauge, which I did not use in this case, can come in handy to help move the patient into a CR position if necessary. PVS material is then flowed into the posterior sectants, capturing the new bite registration. Notice the midline is slightly off to the right side as well. Marking the midline is an easy way to inform the technician of the midline change. Once removed from the mouth, I will go ahead and verify the bite is stable by screwing the wax setup back on the working cast together with the new bite registration and the opposing model. Notice the model is no longer attached to the articulator. From here, it is important to ask the lab to remount the lower model with the new bite registration. As you can see here, our next visit went a lot smoother. The wax setup was inserted, centric occlusion was verified with articulating paper, the excursive movements, the midline, and the vertical dimension were all verified and correct. Capturing the appropriate bite registration at the correct vertical dimension is a very important component to a successful full arch BruxZir prosthesis. This can be the trickiest part of the whole procedure. However, it is important to evaluate the setup and make any necessary changes at this point. It is the easiest time to do so. That wraps up today's troubleshooting video. Thank you for tuning in, and we will see you next time.